Hi, everybody. This is Gigi from Wellness on Wheels, and today I have the pleasure of having my dear friend, Dr. Iman Bar, who is the founder of Newport Concierge Medical. She has over 30 years of experience in medicine and is now board certified in integrative medicine and anti-aging medicine. Dr. Barr has been in the field since, as a frontline physician since February of this year, and has been testing people in her community in Newport Beach and the surrounding areas and for COVID-19, and has some fascinating information to share with us today about the use of stem cell for the treatment of COVID-19, which has been very big in the news for us. So I'm really delighted to have Dr. Barr with us today. So I'm going to let you tell us a little bit about yourself and how you got to this point in being a specialist in this field of medicine.
Thank you, Gigi, for having me. It's a wonderful opportunity to be on your Zoom show. And so I have practiced medicine, and I was always fascinating from the beginning about stem cells. And my training 20 years ago was at Emory, and I did my postdoctoral training in stem cells. However, throughout the years, I've been doing anti-aging and doing integrative medicine. And I have been using stem cells quite a bit for patients that want to be healthier, younger, and sometimes having like some illnesses. So what happened is, like, end of February, I had my first patient for COVID, and there was no testing at the time. So I took it upon myself to try to get the local labs or small businesses to try to support us and get this done. And we even started testing first responders. That's why I was in the news multiple times, like all the way up to Manhattan Beach in LA. And throughout the local communities, I was able to test and manage and treat over 192 charts I have for COVID right now. And it's been a great experience because I've learned firsthand how this disease is very different than the typical coronavirus that we see on every season. So
tell
yeah.
us, Dr. Barr, so I know you've treated hundreds of people and you've been exposed to this. Now, a lot of people have different reactions to the virus. We've heard people who have no severe symptoms, they get over it very quickly, and some who, like, obviously end up in the ICU on ventilator. Now, what is it that's happening that's affecting the reaction to the virus? Why is it that some of us never have any symptoms and some who are younger can have severe symptoms?
That's a very good question, Gigi. Thank you for asking it. So the key for a patient to either have a mild illness, which is a typical of a seasonal coronavirus, just an upper cold, upper respiratory symptoms, not even going down to the lung, versus somebody having a serious disease and with their immune inflammation through the lung and causing a cytokine storm, overreacting immune system, and sometimes people lose their lives for this. It is a wide array of symptoms, and we found through studies, now that we know more, it's been like over several months now, research, that the virus has a very selective kind of interaction with senile or older immune cells. And they found two receptors. One is the ACE2 that everybody knows, but another receptor is an aging receptor, CD26. It's an aging receptor. And that's why came the idea of like senolytics or anti-aging medications can help patients to avoid getting the virus to attack these cells that are in the lung, in the kidneys, in the cardiac, and that's where patients have multi-system failures. So it is interesting to know now in simple terms that the immune system is a key element that determines how this virus affects a person and whether it's just going to be a few days in recovery or a serious illness.
So now you're telling us about the stem cell. Exactly what do they do to our immune system or to address the process of the infiltration of this virus? What do they actually do?
So the great news, in just in April, there is multiple studies that have been out, and that came through two studies in China and Hong Kong, Beijing, the two studies have tried stem cells on patients that were on ventilators, and specifically they used mesenchymal stem cells. So not all stem cells are the same. So stem cells, we all have them when we are babies and we're born, and it's the mother cell that can differentiate to any kind of cell. And their role is very important in healing, regeneration if we have an injury, avoiding also immune reactions that we end up having with aging and with degenerative disease. So the stem cells have been studied and known, especially mesenchymal cells, stem cells, in anti-aging and regeneration of the body. So the studies that started in China triggered that in the United States, and just April 20th, it was approved through the clinicaltrials.gov. April 20th, they started a study using mesenchymal cells, and it will go through June 20th. And there's clinical publications on NIH using the stem cells for critical ill patients that have the lung disease. Of course, there's other studies around the world, like in Australia. Just recently in Mount Sinai, New York, they've had great results with 9 out of 12 patients, and it's remarkable, up to 83% survival in patients. None of the studies that have been done for the investigational medications that we have done any of that. Unfortunately, one after the other is dropping off the charts. But mesenchymal stem cells, there are usually cord, from umbilical cord or mesenchymal matrix that are usually discarded. And there's like banks now, like the blood banks that have them, are offering about 83% survival in patients. And not only that, we know the mesenchymal stem cells have an immune modulating effect, and that can mitigate the horrible cytokine explosion of the immune system that people end up having. So typically the COVID-19, either they have a mild upper respiratory, the second phase in clinical, it goes down to the lungs, and some people survive it, but the few people that have issues with their immune system, especially the T cells, have been inflicted with this serious illness. And I guess mesenchymal stem cells are very specific to help with that.
So they're safe, obviously. They're used in many ways for healing of other areas of treatment and inflammation, other areas that are very specific, whether it's organ or system or whatever. But can they also be used for prevention? I mean, can we somehow use this to boost our system, immune system and other systems so that we don't get sick? How does that work?
Great question. That is a very great question. And to be honest with you, as soon as I heard about the study in China in early March, I actually injected myself. So I do use the stem cell frequency on my patients. We do a wellness injection, and patients come in every 3 to 6 months, and they get those stem cells on regular basis. So I've seen them improving chronic diseases, diabetes, inflammations of the joint. So occasionally we inject them locally in the areas also that have issues. But as a side effects, they're pretty safe. Their side effect would be also looking younger and healthier, and it's an anti-aging medication if you think about it.
Well, we can all use that anti-aging. I mean, you were explaining that as we get older, we really need that boost, right? So it can actually make us feel better, look better. I mean, what are some of the things like specifically that you can point to in your experience in using stem cells?
The recovery of muscles, bones, even cardiac conditions improve. Diabetes have markedly improved with that. But again, the texture of the skin, the hair, people come in and they look younger. Their hair is, looking better. Their skin is lifted. Their muscles is formed again. So over the time, for my patients that have been on a regular program and they come and get their regular wellness, we call them wellness shot, and they get injected with stem cells, they are really, it's almost like the fountain of youth and reversing aging. But again, like if they originally came because of back pain or a shoulder issue or chronic diabetes that's causing trouble, they actually get that double benefit of having the regeneration of their tissues. And then they look younger and they exercise more, they're healthier, they're more out and doing more things than before.
So it's better than getting a facelift. It's better than human growth hormones. It's better than getting injections of all kinds of weird things that we don't really know chemically can affect our bodies. Yeah, I mean,
Actually, there is a facelift now, liquid facelift that uses stem cells, actually, that is totally natural and reverses. So, and yeah, we're not going to get that. That's a different topic. But I think um, anti-aging mesenchymal stem cells, it's the fountain of youth that has been used for over 20 or 30 years around the world. However, United States, we had some limitations because of the FDA approval. But however, now with the FDA approving the use of mesenchymal cells for COVID, and especially for lung disease, it has been used for chronic lung disease in the United States as well, in big centers like cancer centers or bone marrow transplant centers. So it is a very promising field. And now that the FDA is going to be approving this, then, or has approved this, there is more use for it. And I hope there will be more studies for different things other than that. It's been used for different things like graft versus host, different things that actually is approved at this point.
This is very exciting news, Dr. Barr. We really appreciate you being with us today. I know you're very busy schedule, even treating patients on weekends and nights, being a incredible concierge doctor. And if anybody is in Southern California or in the Orange County area, they know how to look you up, and they can certainly get in touch with either one of us, and we will do the best we can to take care of our community. So thank you so much, and hopefully we'll have you back again to discuss some other kinds of areas of integrative medicine, hormone replacement, and other natural approaches to COVID if people cannot seek out the stem cell approach in the future. So thank you again, and it was lovely having you.
Thank you. Happy Saturday.
Thank you. Bye-bye.
Bye.